You got a zhuzh.
Thank you.
You look fantastic.
Thank you.
As soon as you walked out, I was trying to study your face.
The facelift that you see on TV isn't the one that will necessarily give you the best result. The fact is, some of the most popular procedures today can actually be the ones that'll make you look worse. Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon. I'm the founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna cut through the hype and we're going to evaluate 8 of the top facial rejuvenation or facelift procedures that are out there. And I'm gonna give you my opinion about how they rank from 1 to 10. And you're gonna take that and hopefully get armed with information that'll help you make great decisions for your own case. And some of the answers may actually surprise you. So make sure you take a look and watch this entire video all the way through. Patients literally ask me every single day, Dr. Karam, what is the best facelift procedure for me? The choices are overwhelming. There's so many different types of lifts and non-surgical lifts and so many options that it can truly feel like you're lost trying to make the right decision for yourself. Procedures like threads and mini lifts and deep plane facelifts, which have gotten all the rave lately, have made it even more difficult to make decisions. But the fact of the matter is not all of these lifts are created equal. And so many of them are in fact gimmicks, and many of them are outdated, and only a few of them really address the anatomic changes that are happening as a result of facial aging. And really, to understand which lift works, you really have to understand the core problem. What is actually happening as a result of aging? The aging process is elongating the fascia, and it's fundamentally causing the skin and the fat and the muscle all to drift downward. And what happens in this situation is the face changes shape. It goes from this beautiful, youthful heart shape that we see in young faces to more of a heavy, rectangular, long-looking face with age. And at the core of every single one of these procedures is to restore that youthful look back to that heart shape, and not by pulling the skin or the face in a sideways position or in some new orientation that leaves you looking unnatural. Looking as young as you feel and looking natural are the fundamental things you should be looking for. So we're gonna start with the bottom of the barrel. That's what thread lifts are, in my opinion. So it's no surprise what I'm gonna rank it. But what is a thread lift? So a thread lift is something that's been around for over 20 something years and has come and go into the marketplace. As soon as people start to realize it doesn't work, it disappears, and then it comes back in a different form or fashion because it sounds too good to be true. What is it actually promising to do? Well, you're putting subcutaneous threads, which basically means underneath the skin, without having to open the skin or make any incisions. These sutures have barbs on them. And then so the idea is as you feed these sutures through, you lift the soft tissues of the face, the cheeks or the brow or the neck or whatever, and it's supposed to catch the barbed sutures and hold and stay there, fundamentally lifting your face back into that position that we would like. But what ends up happening, unfortunately, is that the tissues never stick. They can't hold on because those barbs are, generally speaking, too small. And that's not even the fundamental problem. It's not the skin that's loose, it's the fascia. And so ultimately what ends up happening is these barbs give way, the face starts to go back to where it was, oftentimes as early as 3 months after the procedure. And you're left with basically threads in your face, a result that looks exactly the same, money out the pocket, and some risks that you've taken that you are probably regretting at this point. So what do I ultimately give this? I give it a 0 out of 10. And who is this ultimately good for? Because I mean, you know, obviously for somebody who's got significant laxity, you know the answer. It's really good for no one. But what about for somebody who's in the younger age range, somebody who's in their 30s or 40s or even early 50s is just starting to see the beginning of aging? The answer is still no one, because starting to age is usually not a slow process. And what you want to do is get in front of it, and doing something that's as temporary as 3 to 6 months that has all these complications potentially associated with it isn't going to get you anywhere. So you're taking risk with no real upside. And ultimately, my strong opinion is avoid this treatment. All right, so next up is the liquid facelift. What a liquid facelift is you're using fillers to try to lift the face. Now, this was a very popular procedure that honestly I used to do a lot of and taught other doctors in the community as I was a trainer for Allergan, the makers of Juvederm and Botox. So I drank the Kool-Aid, and I understood this as potentially being a beneficial and useful thing for people, especially those who didn't want to have surgery or are starting to see early changes. Problem is here, you can't volumetrically lift the face in a way that doesn't leave it looking distorted. So the idea of trying to blow up the balloon or try to fill the tank so that the soft tissues that have now sagged below the jawline are now lifted back up requires a tremendous amount of volume up top. And what ends up happening is you start to get that avatar look, that pillow face look, that unusual look that really isn't conducive to what you used to look like when you're young. You don't look like that when you're young. You don't have these cheeks that come, flaring out sideways. Another technique as part of this is you try to camouflage the jowls by putting fillers along the jawline. Downside of that is your jawline looks heavier than it did before because as that soft tissue already came down, your jawline was looking heavier. Now you've added, fuel to the fire by putting fillers in the apex of the jawline along the chin to mask that gel, and now you end up looking even more heavy. And you look like a thick, heavy rectangle as opposed to that, youthful heart shape that we're really striving for with all of these procedures. So ultimately, from my own personal experience with it, I realized after a while that this approach is not going to result in the type of lift that we're looking for and only made things worse. So I stopped doing it. I stopped advocating for it. My practice stopped doing it. And really at the end of the day, now I think after 20 years, the public is starting to see those results as these fillers started to accumulate over time and people's faces became more and more distorted. Not to mention it makes surgery down the road even more difficult because what ends up happening is these fillers don't ever quite completely dissolve and they end up leading to fibrosis and scarring, which makes delicate dissection through those deep planes much more challenging and difficult for the surgeon who's one day going to do the facelift. So ultimately, what do I give this? I give this a 1 out of 10. And I also believe this is not a treatment for anyone who's in the active aging process. Fillers do have their place for minor things like lip augmentation here and there, fine lines and wrinkles here and there, but certainly not for an overall lifting approach. And if you're on the younger side of the spectrum, be careful because you have that risk of filling slowly but surely to a point where you will become unrecognizable and create a look that is irreversible. So in general, using volume to lift the face is a non-starter in my opinion. Number 3, the neck lift. So this is the question I get all the time. Doc, my neck bothers me. My face is fine. I don't have any issues with my face. I hear this all the time. And that's because our attention oftentimes goes to the thing that bothers us the most. And having a loose, sagging, or waddle under the neck is something that really bothers people. So what ends up happening, a lot of people seek a treatment that directly addresses that looseness or that heaviness under the neck. The problem is people don't understand the anatomy. And I'm speaking specifically here of a standalone neck lift procedure, which a lot of surgeons still do and advocate for. And I want you to understand this so that you can be in a good position to advocate for yourself and make good decisions. But here's been my experience. When you're aging and you're in your late 40s and 50s and beyond, the source of the neck laxity is not the neck, it's the face, because the face is where the platysma muscle attaches. And when the platysma muscle begins to lose its upper anchor as the face starts to sag, well, what naturally happens is the neck begins to sag with it because nothing is holding it up against the jawline and redraping into that beautiful, youthful neck contour. So when you go in here and directly try to either snip that muscle or plicate that muscle and trying to do a neck lift, without elevating and supporting the platysma up top, what ends up happening is as the months and years go by, the neck just starts to sag even more. And oftentimes leaving it with a kind of a really an unusual or an unnatural look to it. So my strong opinion in this case is in the aging neck needs to be treated by vertical elevation of the SMAS, which is attached to the platysma muscle holding the neck up. This is the practice that I have seen works every single time and works beautifully and gives durable, long-lasting results. And that's the foundation, that's the fundamental way of treating the neck. Now, in general, I give this a 1 or 2 out of 10. It might give you a temporary type of an improvement, but in the long run, it's going to fail you and you're going to be upset about it. But who would potentially benefit from a neck lift? Generally speaking, if you're on the younger side, if you're in your 20s, 30s, or maybe even early 40s, and you have absolutely no laxity as part of the equation, but just have fullness under your neck, then an isolated neck lift because of that genetic fullness under the chin is a perfect solution. And we've done that for patients, and I think there's nothing wrong with that because it removes that heaviness out of the tissue and gets that neck looking slender and more defined. But if you're aging, a neck lift by itself isn't going to get you anywhere. You're going to be right back on the operating table before you know it, wanting to get that neck back up. So number 4, the mini lift or micro lift. These are procedures that were big time popular during the early 2000s, late 90s, because facelifts, especially the quote unquote full facelift, has such a negative connotation to it. People who are having that quote unquote full facelift, which I don't quite understand the meaning of because I think it's just a facelift that they're referring to, we're looking so tight and pulled and unnatural. So what ended up happening was the mini lift came to life as an alternative, something a little bit more conservative that would hopefully leave a person looking more natural. The idea was you make an incision, the same incision as you would as part of a regular facelift, but you did less, you pulled less, you moved less tissue, and then you walked away. Well, guess what happens? Very shortly after the procedure is done, you're right back where you started from. Aging is a continuum. It just keeps happening. So what you ended up seeing is that within a matter of years afterwards, you're yearning for another facelift. You're going through the same incision, creating more scar tissue, and finding yourself unhappy with it. So the whole idea of a mini approach or a micro approach or an abbreviated approach or a partial approach, all these different things, in my opinion, is a non-starter. And the reason for this is, and you're going to learn about this as I talk about the other forms of facelifts a little bit later, you need to address these things in a way that's going to give a comprehensive repositioning of the deep structures and also give you durability. Those are the two things that you want. You want to look young and you want to try to look young as long as possible. And these mini procedures simply don't cut it. And I feel, again, we've been there, done that. We've tried them all. I think the cat's out of the bag in terms of its value. In the toolbox, I put this at like a 2 or 3 out of 10. I don't put this as ineffective as a thread lift, but definitely not anywhere near some of the lifts that I'm going to talk about shortly. All right, so let's talk about the SMAS facelift. Now, the SMAS facelift is synonymous with the traditional facelift. This is the facelift that probably started somewhere around the 1970s and has basically been the gold standard of facelifts until very recently, which is going to be some of the procedures that I'm going to talk about towards the end of this video. But the SMAS facelift was a major innovation over the skin-only facelift, which was living in existence from the early 1900s all the way up until basically 1970 when the SMAS was identified as an anatomic layer that basically binds all the facial muscles and the neck muscle together. This is a fascial layer. And the problem with it was brilliant that it was discovered as an anatomic layer, but the downside was when they tried to reposition it, the repositioning went sideways, went horizontally. So every textbook you pick up and read about the SMAS facelift or traditional type of a lift, almost all the lifts were taking the face sideways. Now, it should be clear at this point, because many of you who are watching this video probably go in front of the mirror and you find yourself going like this. You're going upward. You're not going sideways, because when you go sideways, your lips get pulled, your face gets stretched, you look like you've been through a wind tunnel, and it's never a natural look. It's not a familiar look to you. But when you go up like that, all of a sudden you're like, oh, that looks like I used to. So that's the look that you want to achieve. But then you go to a plastic surgeon, they pull you sideways with a SMAS facelift, and then you look like a lizard or some type of non-human creature, and it scares you from wanting to have it done. And this is really where facelifts have really gotten their bad rap, is because of how unnatural and unusual things look. Not to mention that you're not necessarily releasing the fascia, you're pulling the fascia, and that doesn't give it the durability that it actually you'd want. So Yes, it gives you more durability than the mini lift because you're actually addressing the fascia, but fundamentally, it's a pretty poor choice. And it used to be the only choice. Where do I put it in the spectrum? I'd say in this current era, 2025, I think it's a very outdated concept. And there's definitely tons of surgeons who are still doing it because that's how they were trained. But I wouldn't say that's the facelift that you should be seeking at this stage of the game. The evolution of facelifts have come a long way. And this has been fundamentally a surpassed procedure that's in the relics of our field. So the next lift is the brow lift. Now, this is one that I chose to put in here because for a lot of people, this is the starting point. They start to see their brows coming down, they start to see heaviness around their eyes, and they want to get a brow lift. I personally don't perform brow lifts in the traditional sense. And what is a traditional sense? Traditional approaches to brow lifts are coronal brow lifts where you make a long incision across the top of the head and you go underneath the skin and the fascia along the bone, and then you disassociate the brow and you try to lift that whole piece up, skin included, everything goes up. The net result is you get a higher forehead, your brows look like they're in the middle of your forehead, and you just look different, you look surprised. Endoscopic brow lifts are just a less invasive version of that, but you're also disassociating the entire brow and elevating things basically as high as they can go, ultimately still leaving the brows looking different and unusual. Now, under that same sort of approach, there's a lot of different types. There's the direct brow lifts, a pre-tracheal brow lift. There's all these things. But let me be clear about this. The entire brow doesn't age and the entire brow doesn't descend. Because if you look at younger photos of yourself, you'll see that this portion of the brow, the medial portion and the central portion, are generally speaking where they used to be. And the reason for that is the muscles of the brow and the fascia are tethered to the bone in that section. But the corner of the brow, the lateral segment of the brow, is free to float down. As the face descends, it pulls the corners down. So the lateral section of the brow causes the hooding and shows the vector change where, the youthful brow is more sort of like horizontal to the floor. The aging brow becomes more vertically oriented. It starts to point down towards the floor. That is aging of the brow, not the entire brow, but just that segment. So my approach has always been to lift the corner of the brow using a lateral brow lift and not a full brow lift. Literally 20 something years of practice, and I've really never done a traditional or full brow lift for that very reason. It leaves the face looking refreshed. It leaves the face looking natural. When you combine it with work that's being done in the lower face and upper face, it just looks harmonious and balanced, youthful, fresh, and natural, which is at the end of the day what you all want. And every one of our before and after results address this region, which I'm going to talk about in a moment when we speak a little bit more about vertical restore as an approach. But let it be known that a lateral brow lift is a very good way of approaching the aging brow, and a full brow lift, in my opinion, has the risk of causing unevenness, a surprise look, change of identity, all those type of things. So where do I put the lateral brow lift? I put it at 8 out of 10 in terms of brow lift approaches. When it's done in isolation, I put it 10 out of 10 when it's combined with surgery. And in a traditional brow lift, I honestly put it at like a 3 or even lower, frankly, because I just don't feel like it really is for the average person. Now, there are occasional people who do see this, and there's a place for that, but that's a very, very rare situation. We're just talking kind of broadly about normal aging process. So number 7, the deep plane facelift. Today, the deep plane facelift has gained tremendous amount of popularity. I mean, shocking amount of popularity, especially considering it's been around since the 1980s. Sam Hambra, a plastic surgeon out of Dallas, Texas, developed the deep plane facelift. And a number of surgeons throughout the country who are really dedicated to the craft and specialty of facelifts and facial rejuvenation began using the deep plane, and they got wonderful, beautiful results with it. However, the majority of other surgeons were still stuck in the SMAS or traditional facelift category, and they really didn't evolve or learn these other techniques, mainly because some of those early results with the deep plane were a little scary. Sam Hambra would write in his textbooks and his presentations that it takes a minimum of 6 weeks to recover. You see these people, there's occasional risk of nerve injury because the dissection plane is much more delicate and much more tenuous. You're right there with all the facial nerves. Between downtime, risk of facial nerve, it's a much more difficult technique to perform, requires a really strong knowledge of the anatomy and experience. Very few surgeons were doing it. Now, what's interesting is in the social media era, when surgeons who start to show the best results share their results on social media and they get a large following and everyone wants those type of results for themselves, those happen to be surgeons who are doing deep plane facelifts. And as a result of that, now every other surgeon wants to perform a deep plane. So there's a lot more interest in that type of knowledge. But at the end of the day, what is a deep plane? Now that we understand the historical perspective and why it's suddenly become so popular, let's discuss it. So a deep plane facelift is where you are separating the fascia in this orientation, basically this diagonal line. You're going below the facial fascia, but above the deep fascia. That's called the deep plane. It's a separation between the deep fascia and the superficial fascia. And that fascia dissects quite easily if you're in the right plane. But the beauty of that is there's ligaments like the zygomatico-cutaneous ligament and a number of other ligaments along the jawline that once you separate them, it allows the face to freely move without any tension. And the lack of tension plus this large undermining that takes place really from all the way down here and through the neck gives the tissues a tremendous amount of surface area to heal down, forming fibrosis and scar, which allow it to stick in that spot for a very long time. Plus the lack of tension because you've separated all of those delicate ligaments that hold the face up. Once you've separated them, you're not pulling against anything anymore. You're just repositioning. That gives the face the opportunity to basically live in that position without tension for the longest period of time of any facelift technique. So durability, bigger lift, you get to address the mid-face, which is something that no other facelift technique can address. And one of the other benefits of deep plane dissection and lifting is that since there's no tension on the tissues, there's no tension coming across the incision line, so your scars look better. And that's a huge thing. So cosmetically, things just all around look better and they look more normal and natural because there's not that tense, pulled look to the face, which gives this procedure, in my opinion, a 9 out of 10. It's a great procedure, and as more surgeons are learning how to do this and gaining experience with it, you're gonna see better and better results in the category of facelifting using deep plane. So let's talk about the vertical restore. We've arrived at number 8, vertical restore. I give it a 10 out of 10, a perfect score. I want to shake the hand and meet the guy who developed this technique because whatever they did, it was incredible. Okay, so listen, I might be biased. It is my approach. It's a trademark approach that I developed. It is something I want to share with you in terms of like exactly what it is, but the rationale behind it. So remember when I said you lift your face upward like this? Well, look what happens when you do that, right? You lift it up like this and then you get all this bunching in the upper face. I understood that in order to look natural, which for me was absolutely the most important quality of facelifting, is to look like a normal person and look like you used to, because people who come to me want to look as young as they feel and they want to look like themselves. So this is my job basically, to deliver on those two aspects. In order to deliver on that aspect, I realized that natural is important. So that's the vector, this more or less vertically oriented vector is important. Number 2, I recognize after 10 years of doing it in a slightly different way that I wanted to get longer lasting results, and I also wanted to get the midface to come up. But I also realized that if I'm going vertically, I have to treat the lateral brow area, because all of this from here all the way down to your clavicle is literally just one fascia. There's no subunit here. This is all one thing that starts to descend in the downward direction and leaving the face looking heavy and all the other things that are synonymous with aging. So my approach and philosophy was I want to lift everything from the neck, the jawline, the midface, the lateral brow, all up together in unison and harmony so the thing looks completely normal and balanced and there's no mismatches between the top of the face, the middle of the face, the bottom of the face, etc. So treat all 4 areas together. Number 2, I wanted durability and I also wanted that midface to move, so I began to use a deep plane dissection. All the benefits that I just spoke of, durability, release, lack of tension, etc. And since I started doing that, it was an incredible visual result. I mean, people just looked profoundly younger and they looked totally natural, which is, again, at the end of the day, the thing that everyone wants, at least the ones who consider natural as one of the most important qualities of even going through these type of procedures. It gives you that youthful shape, that heart shape. And in almost every case, I combine this with fat transfer. And the reason for that is because the two things that happen during aging is the face begins to sag and it deflates. So by using fat transfer to fill in the temples and around the eyes and the lips and around the mouth, and then repositioning everything, you really do, as far as shape goes, pretty much look like you did when you were in your 30s, which for many people, that's the image of themselves that is stuck in their mind's eye. No matter where they are, if they're in their 50s, 60s, 70s, 80s, and if they're healthy, they see themselves as 30-something-year-olds. So that's what we want to basically achieve and develop. So this is effectively the next level of evolution above a deep plane, because a deep plane ends literally right here. And because it ends right here, the incision of a deep plane is left at the temple. The face has to be more or less driven in a oblique angle, little vertical, but mostly horizontal, or even a blend of the two. But the vertical restore is really more vectored vertically. And as a result, in every case, you have to address it. So the lateral brow component requires an incision that runs along the hairline to elevate the upper third of the face and brings it all together. Another key difference is that well, at least in my hands, it's performed under local anesthesia with IV sedation and not general anesthesia, which means that the risks are significantly lower. General anesthesia has some inherent risk associated with it, but in addition, recovery is faster. So the surgery being performed this way is a huge bonus. Everyone sleeps well at night knowing that they're not taking excessive risk doing an elective procedure like this. And between the cosmetic and restorative changes that occur and the durability of it, it really, in my opinion, hits all the marks and ends up getting a perfect score if the goal is fundamentally to help people look as young as they feel. There you have it, 8 of the most popular categories of facelift techniques that you probably heard about that have been contemplating. And I hope this video really puts it into perspective in terms of how you should be making decisions. Really the final two categories, the deep plane and the vertical restore, are probably the two that you need to be looking at in this era. And again, at this point in the evolution of our specialty in our profession. And although some of the other procedures that we mentioned, including the brow lift and the mini facelift, may sound tempting because they're probably going to be a lot more affordable, and they're the downtime and just seems like a smaller step to take. At the end of the day, remember why you're doing this in the first place. Remember it's your face. Remember it is an investment that you're making for the long run. There's no rush to do this, but ultimately, if you're going to do it, you're going to want to do it the right way. And in my opinion, this is the right way. And it's 20 years of doing these different things that have led me to this conclusion. Now, if you have had a different experience, you have a story you want to share, please make sure you share them in the comments below. And if you just enjoyed this and if it helped you, I'd love to hear about that as well. If you haven't already, make sure you subscribe to this channel so you can get these videos every single week. But also, if you want to learn a little bit more about anti-aging skincare and facial rejuvenation procedures, all in an email in our newsletter, the Karam MD Journal is an incredible thing you want to subscribe to. Make sure you check that out. Links are in the description. Until next time, my friends, Dr. Amir Karam.